our Ask the Expert session on asthma, common myths, common misconceptions, and questions, your burning questions that you really just want to be answered. And we are with our expert, Dr. Kristine Gutierrez. Once again, thank you for coming back.
Thank you.
And
It's a pleasure.
Yes, of course. Always fun to have you around. And as you know, she's an expert on allergy, asthma, and immunology. So we would like to give her again a warm welcome. Hello, Dr. KG. Okay, so I think we want to, again, the same way we started our previous session, we want to start by defining a few things about asthma. So if you could please share.
So when you talk about asthma, it's not the lungs that have the problem. It's the airway moving towards the lungs that can actually have a problem. So usually you have what we call swelling, or we call it inflammation
Of the airways.
of the airways, and then there's a muscle right around that. Sometimes closes and opens. So basically, that's how asthma works.
Okay, so we actually have it's very interesting that your specialization is allergies, asthma, and immunology. So there's actually a question from one of our moms, and she's asking, is there a link between allergy and allergic and rhinitis? Are they between asthma and allergic rhinitis? Are they linked? Are they the same? How are they, or are they completely different?
Okay. First of all, when you talk about asthma, most of it is allergic. There can also be a non-allergic asthma aspect of that, but more often than not, it's an allergic cause. It's the reason why, based on your question, is allergic rhinitis linked? Yes, because that's what we call one airway disease. Wherein if you have allergic rhinitis, more often than not you have asthma, and vice versa. If you have asthma, more or less you have a higher percentage of you having allergic rhinitis. So that's why more or less it's interconnected or linked.
Oh, that's not good news for some people. Okay, so this is the most common question we actually got for this topic. Is it true that there are some physical activities that a child who has asthma cannot engage in? Or what activities actually would you recommend to help?
Okay. First of all, when you have asthma, just like any allergy, I have to stress that it has no cure.
Oh,
Okay?
sorry.
It can only be controlled, but our goal is for that child or that person to live a normal life. It's the ultimate goal right now for asthma, that a child can do what other kids can do. He has to take control of his asthma. He has to know what his asthma is, and also the parent, and try to let the child live a normal life. Having said that, you have to teach the parent and the child to identify whether he has symptoms
Okay.
and stop what he's doing and take the appropriate medications. That's the reason why if you have asthma, you could really do other physical activities, especially when you're in good control. My son is asthmatic. He played for varsity of soccer. No problem with that. No? But however, if he has an acute asthma attack, no matter how much that coach would ask me to please let Derek play, I would say no.
No.
You
But-
cannot.
So what are you saying that the child and the parent should both be able to learn when an attack is oncoming?
Yes.
What are the signs?
Yes. Usually for bronchial asthma, keeps on coughing. The child keeps on coughing. There is some form of, we call hingal in Filipino. There's difficulty of breathing, especially after running, after laughing out loud. You'd suddenly feel that sudden chest tightness. So most probably it is bronchial asthma. But the hallmark is nighttime cough.
Oh.
So if at night you wake up, keep on coughing, you try you're just a bit of air hunger, you try to breathe in, then probably it is bronchial asthma. Okay? And the goal for these kids who have asthma, is for them to be able to run, so it's also not good for us to try to keep them confined.
Okay.
Because if you keep them without any physical activity, they tend to be obese.
Yeah.
And according to studies right now, if you are obese, it exacerbates your asthma.
It's a cycle. Yeah.
It's a cycle. That's why you try to keep them as healthy as they can, as active as they can,
As normal.
as normal as they can. However, if they have an acute exacerbation, they really have to rest until they can take control of their airways again. Then, of course, they should be able to do what other kids can do.
So it's rest.
Rest. You asked about activities, right? So
Yeah.
one recommended is swimming. Swimming, so we usually have to let them swim regularly so that they can learn proper breathing, stuff like that. But definitely they can do what other kids can do.
So we're talking about management and the fact that it's never going to go away. And it's interesting because one question from Mommy Bea is that matagal na it's been a while since I have been since I've gotten an attack. And she's asking if it's like it was years ago, like maybe she's 21 now, it was when she was 17, and is her question is that is there a chance that it's going to come back? And also, well, I guess my question is that a lot of people on the feed were talking about outgrowing asthma. And why is there a so one question is there a chance that it's gonna come back for her, and another is why is there a misconception around outgrowing asthma then?
So first of all, yes, there's a chance that your asthma can come back. It can be triggered by certain things, like for example, if you have infection. Probably it's also the pollution right now that's worsening all our asthma symptoms, so that's also another possibility. So they have this misconception that they can outgrow it because they're not acutely exacerbating like before, or they don't have the triggers, as we call it, that would induce them to have their asthma. But sooner or later, you try to ask them by symptoms, sometimes they may have the same exciting symptoms, but not as severe as they were before.
Oh, there you go. Okay. So you mentioned triggers, and someone actually also asked, is stress a trigger?
Yes.
for asthma?
Just like what I said before about
Allergies.
allergies, definitely stress can be another trigger. You see, what happens is you have to learn how to yoga. Just kidding. But, like the problem in asthma, if this is our airway, there's a muscle around our airway. So that muscle sometimes tightens. So just like a tube, when you try to tighten it, you blow into it, you hear a wheezing sound,
Yeah.
something like that. So sometimes if you see patients with asthma, they have wheezing. And the one that can relieve the bronchoconstriction, as I call it, or the muscle, would be our nebulizers, like our salbutamol. So it would help loosen that, widen it up. But the triggers for that is a lot of things. So it can be when you're young, when you're a child, it could be a viral infection. A simple cough and cold can eventually lead to asthma for an asthmatic child. As they grow older, then they have the triggers like dust, like weeds and pollens and stuff like that. So they can also trigger that. So as they grow older, there's stress, changes in weather, extreme laughter. I have a lot of patients who are like that.
Extreme laughter?
Yeah, they keep on laughing and laughing and laughing. All of a sudden, they would feel that asthma attack coming in.
That's
So those are the things that can trigger that.
So this is actually a question from Danny Mark. We're talking about triggers, but I'm not sure if it's the same thing. His question is, what are the causes of asthma?
So more or less it's right. It's more or less the same.
Triggers,
So
right?
just like any allergic disease, asthma is genetic. So you up your chance of having allergies, or asthma for that matter. If both parents have the same kind of asthma, for example, both of them have bronchial asthma, you have a chance as high as 80% to have a child having asthma. Okay. If none, then if you have one, then it's as high as 50%. If none, there's a 2 to a 15% chance of having allergies or asthma also for that.
This is from Mommy Luz, are there things we can do to reduce the risk of asthma attacks?
In terms of reducing the risk for asthma, so there are a lot of recommendations right now, but of course we always have to base it on evidence. But they say breastfeeding can prevent allergies, breastfeeding can prevent atopic dermatitis. Therefore, if you try to arrest it at the part of atopic dermatitis, there's a chance it will not progress to bronchial asthma. So those are one of the things. So breastfeeding is still the best for babies. If you can breastfeed for at least 6 months, and if you can go beyond that, then so much better. You lessen the chance of your child having your asthma.
And this one is a question from Mommy Karen. Are there natural remedies for asthma?
In terms of natural, unfortunately, based on evidence, none yet as of now. So, as part of the management of asthmatic disease, first of all, both the parents and the child, especially when they could understand, They have to know when they're having an attack. They have to know what they're supposed to do once they have an attack. They should not try to tolerate it. That's when you get the severe
It's bad,
ones,
yeah.
no? The bad ones who just suddenly collapse and then they're gone. They expire.
Oh my
They're
god.
dead. Because in Filipino we call it pagtitiis. So they try to how do you say that? So they try to not they try to tolerate it, no? But I always tell them once you have an acute attack, then you have to either do salbutamol nebulizer, a short acting beta agonist like your salbutamol or terbutaline, and your inhaler medications. You have to do that at once. Okay? That's why it's part of our asthma education. All my patients know that. They have a notebook. So they know what they are supposed to do. Because part of proper asthma management is that the parents and the child should be able to know what they're supposed to do next. No? So education is very important.
So this is interesting. It's from Mommy Sharon. Is it bad to be dependent on the inhaler then?
It's a very good. I get a lot of questions about that. Some of the parents even don't want to nebulize their child for the fear that they tend to be quote unquote dependent on that medication. For starters, it is your beta-2 acting beta-2 salbutamol or terbutaline that can widen your airways. The problem is some parents or some people would just keep on nebulizing, thinking that it's just going to keep it open. But the main problem there is the swelling inside. Okay? So you have to address that swelling at once for you to be treated. So it's not good to nebulize all the time. You have to go to your doctor, try to get assessed because you have to give added medication for that. Okay?
Oh, interesting. And speaking of interesting, I'm not going to show a photo, but when I was a kid, my mom used to let me eat grilled flying lizard.
I didn't know it was flying. Anyway.
Flying lizard. And because it's said to be able to cure asthma, though I felt better after, I just wanted to ask if this really did help.
Unfortunately, it's not. Whether it be lizard or seahorse, right? Seahorse, somebody would say seahorse. It's not evidence-based or it's not found in science that it can actually relieve your symptoms of asthma.
So please,
unfortunately,
children, lizards, and seahorses,
Yeah.
let them be.
Okay,
this
live.
let them live. What should I do? This is for Mommy Christina. What should I do if my kid has an asthma attack and we don't have an inhaler?
Unfortunately, you should always have an inhaler. All
Be
the time.
responsible.
It's something that you have to stress when you have your asthma. You have to be ready with your medications all the time. Your salbutamol or terbutaline can come in many forms. Either a nebulizer, by way of your nebules. You have your inhalers. You also have your tablets or syrup form for that. So there are a lot of ways for you to bring, but you have to be ready all the time. There's also a question now what we call controller medications.
Okay.
As I mentioned, your asthma cannot be cured. It can only be controlled. So people should be very much aware. There are a lot of controller medications right now. That's why we have very good management of bronchial asthma. Okay? So these inhaler medications should be taken continuously until your doctor says so. Because they can assess, they are monitoring you how your asthma is. That's why you have to take it because that most definitely you're going to feel good. Your child will be feeling better when they take these controller medication and say, I have to stop it now. So I think my child is getting better.
No.
Unfortunately, no, because you have to really monitor, look at the symptoms of your child. That's why usually for asthma management, it's a partnership of both the doctor and the parent.
And the child.
And the child for that matter, no? So it should be a very good partnership because during follow-ups, especially for example, I cite my patients, I have to ask them how often are their attacks, do they wake up at night, do they have morning coughs, how often do they use their salbutamol inhalers, because that's how I monitor. Or we can do objective measures. We have like our spirometry to try to check whether they have good control or your peak flow We just have to blow into a tube and we can measure more or less if they have very good control of their asthma. So they should not be scared of their controller medications. They have, I think the parents and the child should understand why they're taking that.
Okay.
Okay, so I think it's the most important.
So it's really a partnership.
Yeah, it's really a partnership because sometimes parents feel that their child is too dependent on the medications. Okay, that's why it's always part of my management to try to see the trigger, and more often than not, it's the dog or it's the cat or it's the dust, it's the lifestyle that they have. It's their exposure going to the park. And if I really try to tell them, you have to avoid all these things, they basically get better after a time.
It's actually, you mentioned dogs. There's actually a question from Mommy Ash. Is it true that if you have a dog while your child is still an infant, that there is a possibility that your baby won't have asthma?
Not exactly. So there are mixed studies about that, dogs or cats.
Okay.
They say if there's early exposure, develop sensitization. We call it masasanay ka na while you're young, therefore you're not going to react. But it's still not recommended at this point.
At this point, yeah. So until further
Further studies would be, then yes, we can probably recommend.
Speaking of babies and asthma, Daddy Sam is asking, when can I confirm if my baby has asthma?
That's a very good question because it's difficult, I have to admit. In children 5 years old or less, it's difficult for you to diagnose whether the baby has asthma or not. That's why we're not very quick into saying, oh, that's asthma. Because to start with, they cannot do objective measures for you to diagnose a baby as having asthma or not. Because more often than not, there is what we call a viral wheeze. When we talk about viral wheeze, these are asthma-like symptoms. Okay, that present they're like bronchial asthma, but it's not because it's caused by a virus. What happens there is the airways, the muscle, gets hyperreactive because of the viral infection. Likewise, there's swelling or what we call inflammation in the airways. That's why there is because of a viral reaction. That's why they have asthma-like symptoms. And it is usually preceded by cough, colds, or fever, the usual upper respiratory tract infection. Then they start wheezing. However, if it starts to be recurrent or they start wheezing without a viral infection, then you can consider a bronchial asthma. That is also the reason why it's really challenging, I have to tell you, to diagnose a patient 5 years old or less as having asthma. Because we have what we call a therapeutic trial, wherein we try to give medications like your salbutamol inhalers or your nebulizers together with your steroid. And if they improve, then more often than not, they are diagnosed with asthma. But it's difficult. It's a challenging one. So you have to see whether it persists until they're older.
Oh, no. And you can only confirm it once they're 5 years old and
usually.
above.
Yes.
Oh, okay. Well, let's hope it doesn't
But
turn
of
out
course,
to
if
be
there's a
that.
family history plus that, then you can diagnose the
Chances.
patient as having. But you should not be very quick to diagnose. So you have to ask your pediatricians or ask an expert about that so that you're sure your patient has asthma or not.
And to just keep
Yes,
monitoring,
monitoring.
keep doing the
That's
visits. Okay. This is, I suppose, it's a practical question. Will air conditioning help keep someone from having asthma?
Yeah. There's what you call the HEPA filters, which have been found to more or less lessen the triggers. Because as I mentioned before, some of the common triggers, especially for inhalant allergens, they're what you call indoor and outdoor allergens. For the indoor allergens, the more common ones are the dust mites.
Oh,
So these are the dust, like
yeah.
those, as I mentioned, that feeds on your dead skin. So it's abundantly found in the bedroom. So another one would be cockroach and molds. So the HEPA filters would more or less help that. No? But the number one thing is you should remove the carpets in your room.
Carpets, yeah.
You should try not to put your slippers inside the room. Try to keep it outside.
So I guess, yeah, really one of the biggest learnings we have, I mean, personally, is that asthma is an allergy.
Yes.
And people,
More often.
and people think of it as a,
It's separate.
Yeah.
It is a genetic disease.
Oh,
To start with,
but
genetic. Yes. But it can also be triggered
by
by the
so
environment.
Really,
So there. Then you have your cockroach and mold. Then you have your outdoor allergens like your exposure to your pollens, like your tree, your grasses, and your weeds. So they can trigger that.
Oh, okay. So I think we have one last question, which we may have already answered a little bit, but just to get like a definitive answer, how do we know if the child's and this is very practical advice, if the child's cough is viral or asthma?
Okay. If it's viral asthma, the difference is this the tricky thing about having asthma is that a virus can trigger it.
No.
Okay, so if you have a common cold,
No.
after a while they may start wheezing.
Oh
So
my
it's
goodness.
although it may be quite difficult to distinguish one from the other. Again, as I said, if there's a presence of your nighttime cough, daytime symptoms, like you keep on coughing in the morning, it's episodic, then more or less it is an asthma. Okay,
Wow.
but if you're already a known asthmatic, you're almost always sure if a viral infection you'll get triggered right after.
Oh,
So you have to
yeah.
have the appropriate medications with you.
Yeah.
You should have your salbutamol with you, or your terbutaline with you, your inhalers. You don't forget to take your controller medications every day. We have a lot of controller inhaler medications right now in the market, and the safety studies are pretty good. Okay, because sometimes people would ask me, Doctor, I'm really scared about the side effects of the medication.
Mhm.
Won't my child grow smaller? Liliet, or the height-wise because of the steroid, the inhaled steroid. But according to studies, if you don't control your medication, if you don't control your asthma, what happens to you is that you don't have enough air going inside because you have asthma. Therefore, it's the disease that causes you being small rather than the medication.
Oh, that's so.
Yeah. So it's good for you to have yourself checked, have yourself monitored whether your asthma is in good control or not. Because we have a lot of options right now. If before, I have a lot of patients who come to me and they say it's asthma. It's like they start crying. It's kind of, what's wrong? Because they feel it's like a life sentence or death sentence for their child. So, no, right now we have a lot of ways for us to try to control asthma. And that's why I really think it's important for parents and for patients to understand what they have. Because once they know what they have, they can take control of that.
Yeah.
And I think that's the most important
And it
thing.
should be very cooperative
Oh, yeah.
and helpful when it comes to managing
Yes.
asthma.
And I think you should not be scared to ask your doctors. That's what I really think. Doctors now should also be able to explain pretty well what the disease is so that they will understand and help their patients more by doing so.
Okay, so just as a last question, I think this one's for me. Are there any other misconceptions or myths that you'd like to dispel for our audience?
Well, probably one thing about asthma is that we don't try to limit the activities of kids right now. Okay. However, let's not also overdo it. Okay, you have to know whether you're acutely exacerbating or not. If you are acutely exacerbating, then I tell my patients, you cannot play basketball, you cannot play soccer. But once you get control of that, then you can go to your normal activities. There's some parents would say, bawal magpawis, they can't sweat. And they would put like towels at the back of their child. But more than that, if your child is acutely, you have to let them stop playing. Really stop.
So it's the
unfortunately.
actual activity
Yes.
and the lack of rest.
Yes.
It's not the sweat.
It's not the sweat or something.
Okay.
So that's also very important. I think that's one thing I want to stress right now, that people with asthma, kids with asthma, can take control of their lives. They can actually do what other kids can be doing as long as they understand and know what their disease is.
Okay, thank you, Dr. KG, for your time. Thank you, everyone, for listening in.
Thank you.
And if you have comments, just write them right there, down there. Do write us what you thought about today's session, what other topics you'd like to suggest. And I hope everyone has a good day. Thank you, Dr.
Thank you.
for joining us. It's
Bye-bye.
always a pleasure having you here.
Okay, bye.
Bye.